We begin this edition of Health Talk discussing safety, just as we do each morning in Safety Huddle and at the beginning of each meeting at the Medical Center. In the past few months, the Medical Center has impressively increased awareness about safety with the rollout of numerous tools which will help us become a high reliable organization. Carrie Eaton, Chief Administrative Officer, discusses why safety is at the core of all we do.
Well, high reliability organization is really just what it says it is. It's that you should be able to rely on the organization to do the right things for patients all the time, not just some of the time. And there are certain behaviors that are associated with high reliability organizations. One of the things that we learned was that there's behaviors associated with, for example, always making sure that patients don't get an infection when they're on a ventilator. And there's maybe 4 or 5 things that if we do it every time, we can make sure patients don't get infections on ventilators, where we used to think that that was sort of the cost of being on a ventilator, that some people would just get ventilator-associated pneumonias. Now we found out that there's certain behaviors that if you practice them regularly and reliably, you can keep patients safe. And if you do this all the time, you can reliably not have a safety event for a patient when you're in the hospital. So our work has been to teach our patients, our families, but mostly our employees, how to practice these safe behaviors so that we don't have unexpected adverse events for patients that are within our own control.
One of the elements of being a high reliable organization is to reward and recognize our safety heroes. In this episode of Health Talk, we celebrate the great catch of Leonard Adoricio from the pharmacy department. A perfect example of CUS, which stands for I'm concerned, I'm uncomfortable, we need to stop, this is a safety issue. Lenny's actions protected a patient from receiving an inappropriate dose of medication, even after he had questioned the order.
Yeah, even though a lot of times pharmacy work is done behind the scenes, we're very proud to be a part of the healthcare team here at St. Vincent's, and our main job is to ensure patient safety. And we try and do that every day.